caregiver, you will soon realize that there is not enough time to do everything you want to do in your shift. In fact, lack of time is a common complaint of most people. Hi, I'm Barbara Harris, registered nurse and nursing assistant instructor. And today's topic is time management and work organization. I work part-time as a staff nurse in a long-term care facility, and I personally do use all of the tips I will be sharing with you today. When you think about why you want to put your energy and focus into becoming more organized with your time, think about the benefits that you will enjoy from being more efficient with your time. You will see results in terms of the quality of the work that you do, in terms of the quality of the care that you give to your clients. When you're more efficient with your time, you have more time for small things, special touches for your clients, such as a special hairdo. You will also see results in terms of quantity of the work that you do. You will find yourself getting more work done in a shorter amount of time. You will feel as if you have a more enjoyable and satisfying job. You'll feel better about the work that you do if you are more organized and efficient. How do you go about planning your time? How do you make a plan for your shift of all the things you have to do in those 8 hours? Well, you start with, generally at the beginning of a shift, you are starting with report. You get a report on your clients that you are going to care for. Generally, you are given a list of the clients for whom you are responsible. Pay attention to those clients and their needs and try to decide which of those clients have higher needs and prioritize them. I mean the clients who will be needing more of your time for various reasons. Perhaps they are very ill that day, going through the dying process. Perhaps they are particularly anxious or demanding that day, or maybe all the time, and you just know that you will be needing more time with that client. So plan for that. Plan to spend more time with those clients and plan to make more frequent trips to be checking on those clients. You want to set goals in your schedule for certain times that certain tasks need to be completed by. If you start your AM shift in the morning and you know that you have to have a certain number of clients up and ready for breakfast by a certain time, pay attention to that time and how many minutes you have, how many clients you have. Try to average out the number of minutes you will have to care for each client and get them up and ready. And as time goes along and you have cared for a couple of clients and gotten them ready, look at the clock. Watch the clock often. Watch your time. Now, how many minutes have you spent with each client up until this point? If you continue to average the same time for each client, are you going to make your goal? If not, find a way to pick up your pace or ask for help. When you have a plan for your shift, remember, you have certain times and certain goals for things that need to be done at certain times, but you also need to keep that plan flexible. You cannot plan every minute of your shift. It is impossible. Don't even try. There will be things coming up that you cannot plan for. So basically, expect the unexpected. Try to, this is what I do on my shift, is I try to make sure my tasks are done by the time that I have chosen that they need to be done, or that when they are required to be done, in a timely manner, and try to surpass that goal so that I have a little extra time, a little leeway for the inevitable unexpected event that will come up, so that I can take care of that and get all of my work done in the allotted time that I have. You want to consider times that you're going to be needing assistance from your coworkers. There will be tasks you need to complete For example, perhaps you need to transfer a client who requires 2 CNAs to transfer from bed to wheelchair, and you will need the help of another CNA. As soon as you know this information, you need to seek out another CNA and plan to be sure that that CNA is going to be available to help you at the time that you're ready, that you need their help. You'd never want to simply go ahead and assume that you could seek out that CNA for their help when you're ready without talking to them first. Remember that your client's physical needs always come first. You will have many different tasks that you do on your shift, and most of them are taking care of the physical needs of your clients, but other tasks include housekeeping type of duties. For example, if you are preparing to return the cart of the dirty meal trays back to the kitchen, and a client calls out to you that they need to go to the bathroom right now. This happens all the time. You're faced with a choice of what do I do next? And always, always you must attend to your client's physical needs first. That always comes first before those other housekeeping type of needs, those tasks that can wait. I want to talk a little bit about your frame of mind as you go about trying to be more efficient and organized with your time. You want to be mentally focused on the work that you do. And so this means you must leave your personal problems at home. And the good news is you get to leave your personal problems at home. Having a bad day is not a reason to be poorly organized in your work. Take that emotional energy and throw it into your work and rechannel it and focus yourself, and you will feel better and find you are having a better day. I want you to think of yourself as part of a team. Among the list of things which will be unexpected tasks that may come up that you need to find time for would be also helping your coworkers, taking care of their clients as well. Remember that if you're working as part of a team, perhaps in a long-term care facility, for example, you cannot do it alone, nor can your coworkers. They will need your help just as you need their help. You want to focus on your clients that you're caring for, their needs, not so much your agenda, your schedule. Remember, their needs comes first. That is your focus of how you choose what to do next, and will help you decide how to better organize your work. I have a list of shortcuts which you can never take in an effort to organize your work and your time. It may be tempting to try and do some of these things to save a few minutes here and there, but it is never worth it. For example, failing to take the few minutes it will take you to wash your hands at the times that you know that you need to. You may think that you're saving a few minutes here and there by doing something that perhaps you don't think is important. But remember that hand washing is the most important means of infection control. And if you sacrifice this step, you are putting your clients and yourself at risk for infections. And what happens when a person becomes infected with, for example, a bladder infection? They will begin to suffer symptoms like frequency. That means they're going to be asking you to take them to the bathroom 10 times a day maybe. And then you haven't saved any time at all. Not asking your client what else they need before you leave the room when you're done with the cares that you have done with that client. Please stop and ask them before you walk out of the room, what else they need from you. If you don't, you're very likely to find yourself starting to engage in your next duty and finding that that client is ringing their call light asking you to come back to do some small thing that you forgot to do for them before you left. A shortcut you should not take is to neglect helping your coworkers. Again, your coworkers need you as much as you need them. Do you know the phrase, what goes around comes around? The more likely you are to be eager and willing to help your coworkers, well, the more likely they are to be eager and willing to help you. And believe me, you will need their help. It is a team effort. Not spending extra time with your high-need clients is a shortcut that you should not consider taking. Your high-need clients will require more of your time. Plan for that. Plan to make more trips to that room. Make it a part of your schedule, and don't skimp on the time that they need from you. Forgetting to anticipate the needs of your clients. This is a step above simply meeting the needs of your clients as they ask you to meet them. This can be, for example, if you're walking down the hall, perhaps in a long-term care facility, and you see a client in their room. Well, they look fine, but if you look closer, you realize they look a little restless, a little fidgety maybe. And if you think about it, you realize it's probably been quite a while since they used the bathroom. Now you, at that point, have a choice to go in that room to stop what you were going to do and go in that room and take care of that client and ask them if they would like to use the bathroom. Or you can choose to keep walking and pretend you didn't see anything. If you choose to keep walking and save time following your agenda, what may happen is that that client will perhaps try to get up on their own and use the bathroom without your help, and from that serious incident, perhaps injuries can result. So that is a shortcut you simply cannot take. Not communicating with your nurse. When things happen with your clients that you know your nurse needs to know about, if someone tells you that they're in pain, if a client appears to be more confused than usual or appears to be ill for some reason, is not quite right that day, it will require a little time from you to go out of your duties that you had planned for those few minutes at that time, to stop your agenda and go to your nurse and tell her what you've seen. But that is a shortcut you can never choose to take because it is so important to do that right away. You also would like to make your nurse aware if you are running behind schedule. Your nurse is responsible for the overall care of the clients that you are caring for. And he or she needs to know if you are having trouble meeting all of your clients' needs. Perhaps she can offer you some problem solving, some assistance, or some other suggestions to help you get your work done on time. Safety measures, such as using a transfer belt to transfer a client from bed to chair, for instance. This is a measure which takes time from you, takes time to do, especially if you don't have the transfer or gait belt with you and you have to make another trip to go get it. This takes time. It may be tempting to skip that step. You can never opt to skip that step. It is too much of a safety risk for your client. To skip that safety measure puts them in jeopardy of falling or another injury. Never forget to honor the rights of your clients. It takes time from you to knock on the door, to try to get their permission before you enter the room, to pull the curtain, to shut the door before you do your cares, to explain to them what you are doing, to reschedule your tasks if they suddenly decide they don't want to take a bath right now. All of these things take time from you, but these are not shortcuts that you could ever take. You could never skip those things. They are too important, and they are a requirement from you in providing quality care for your clients. Well, now that I've described all the shortcuts that you cannot take, and I've made it sound like it's going to take you all day to get your work done, I do want to go over some shortcuts that you can take. Yes, there are some things that you can do to become more efficient with your time. Personal conversations. This means gabbing with your coworkers. It is fun. It can steal minutes away from your work of what you are doing. You want to cut short the personal conversations with your coworkers. No matter how juicy the gossip is, it can wait until break time. Dawdling and lingering. Think about the time you spend doing a certain task and compare that with the time that perhaps another coworker of yours who is more efficient with their time. How long does it take them to do the same thing? Are you spending more time than they are? Can you pick up your pace? Try to match their time. If it can be done in less time, you can do it in less time. Any hesitancy to obtain information, cut short your reluctance to look into a chart or a care plan and find that information that you're going to need to safely care for your clients. You don't want to put off finding out how a client transfers until that moment when they ask you to transfer them or when you need to, because then you'll find yourself backtracking to go and look that up. You also want to cut short your reluctance to ask questions. It can be embarrassing at first to be asking what feels like stupid questions. But remember, no question is a stupid question. You need to find out the information that you need to know in order to provide quality care for your clients. So just go ahead and ask, and you'll be glad that you did and that you have the information. You want to cut short excessively long break times. Watch the clock when you go on break and be sure that you get back on time. Because remember that in your absence, your coworkers are picking up your workload in your absence and taking care of your clients. And just think how precious 5 minutes can be to take care of what needs to be done. Don't rob yourself of precious few minutes in getting back to your shift and getting your duties completed. Backtracking. Try to cut short the habit of forgetting to take items with you to a room, which then necessitates another trip back to acquire that equipment that you need. You can waste a lot of precious time backtracking. So, for example, if you're in the hallway and you're passing water and towels, and one of your clients down the hall rings her call light, instead of making a second trip, first answering the call light, then delivering the water and towels, you can take those water and towels with you. Save yourself a trip. All the time there are times that you can take things with you when you know you're going to be going to that room, and save yourself some backtracking. I want you to take advantage of the tools that are available to you to become more organized in your work. First of all, in report, listen carefully, not just to what the nurse tells you specifically about your clients, but listen to, if you have the opportunity, listen to the entire report that the nurse hears and try to pick up on little things about your clients, little clues that will help you be more organized and be better able to meet the needs of those clients. You want to write things down. Please have a piece of paper and pen with you at all times and write everything down that is pertinent information that you need to know to provide quality care and to pass that information to your nurse. You want to consult the chart or the care plan or wherever the source of information is in your workplace to find the information you need to give good quality care to your clients and to better make a plan for organizing your work and your time. Feel free to ask your nurse for information. He or she is your resource, your best resource for information on your clients to find out how you are to care for them, to better decide how you are to organize your time. Ask your coworkers. For instance, if you are going to be caring for a client that you have never cared for before, your coworkers can offer you valuable tidbits which will help you be more efficient. If, for example, if you know that Mrs. Smith, if someone tells you that Mrs. Smith likes a glass of cranberry juice at bedtime, if you take that with you on your way to the room to put her to bed, well, you've saved yourself some backtracking and you are more efficient than you would have been had you not asked your coworker. You want to recall the preferences of the clients that you're caring for. Now, some of the clients that you care for are going to be rather particular and have a lot of specific requests for how certain things are done just a certain way. And I know myself, every time I care for a new person who has a lot of requests from me, I find it a bit overwhelming. And I'm surprised because I wasn't anticipating that. But I make a mental note of all those little things that that person likes and requests. And I'm always surprised how the next time I care for that person, I already know these things, and my time with that person goes along much more smoothly. Finally, at the end of your shift, before you leave, take a little time and make an extra set of rounds. And I just mean, if, for example, if you're in a long-term care facility, take an extra walk down the hallway, look into all the rooms of the clients that you've cared for that day. Think of what you've done with them, and you'd be surprised probably some small tasks that you may have missed will come to your memory at that point, and then you will be able to complete everything that you need to do, and you will be able to leave work with a good feeling, knowing that you have completed a job well done in a very organized and efficient manner.